Good morning. So I would like to present my PhD topic, which is the investigation of the efficacy of platelet-rich plasma treatment in chronic dermatological disorders. I'm Fanni Meznerics. I'm a PhD student at the Department of Dermatology, Venerology and Dermatooncology of Semmelweis University. My vision is that patients with chronic dermatological disorders could have a better quality of life, and I would like to achieve that by finding new topical therapeutical options for chronic dermatological disorders to help these patients. So here you can see my specific goals. I would like to investigate the therapeutic effects of platelet-rich plasma in the treatment of alopecia areata of the scalp and also in chronic wound management. So my first topic is investigating the therapeutic effects of platelet-rich plasma in the treatment of alopecia areata of the scalp. Alopecia areata is an autoimmune condition where we can see inflammation-induced, usually patchy hair loss, which can affect the scalp, the beard, or even the whole body. And it can lead to a serious deterioration in the quality of life. The lifetime incidence risk of alopecia areata is estimated at 2.1%. And regarding the treatment options, triamcinolone acetonide is the first line of treatment in localized alopecia areata. This is an intralesionally administered corticosteroid. But as you can see, there are some problems with this treatment modality. One of them is adverse effects like atrophy or telangiectasia, and the other problem can be steroid phobia. Steroid phobia is a more and more commonly seen phenomenon in the field of dermatology when patients fear the steroid treatment and don't want to get the steroid treatment. So when one of these problems occur, platelet-rich plasma, if proven effective, can be a great alternative in the treatment of alopecia areata. It's a relatively new treatment modality in the field of dermatology. It contains concentrated growth factors and cytokines, which can promote hair regrowth. It is already widely used in the treatment of androgenic alopecia, which is a different kind of alopecia with different pathomechanism. So our aim is to evaluate the effects of platelet-rich plasma on hair regrowth in alopecia areata. The clinical question is that does platelet-rich plasma increase hair regrowth in alopecia areata compared to triamcinolone acetonide? The population is patients diagnosed with alopecia areata of the scalp. The intervention is autologous platelet-rich plasma treatment injected to the scalp. The comparator is triamcinolone acetonide, also injected to the scalp. And the outcome is hair regrowth, estimated with the help of the SALT score, which is Severity of Alopecia Tool score. So our hypothesis is that platelet-rich plasma is as good as triamcinolone acetonide in the treatment of alopecia areata. We conducted a systematic search in 4 databases, and here you can see also the date of the search and the search key which we've used. And here's the flowchart of the selection. Based on the full text selection, 7 articles were eligible. From these 7 articles, we could extract data from 3 articles. The other 4 articles didn't include all the data which we've needed, so we contacted these authors and we are waiting for their results. So now I would like to present the data from the 3 articles which we could use. As you can see, there's no significant difference between platelet-rich plasma treatment and triamcinolone acetonide treatment. So we can say that platelet-rich plasma is as effective as triamcinolone acetonide in the treatment of alopecia areata. So it could be a new steroid-free treatment modality for alopecia areata. It can be useful when the problems with steroid treatment occur, like I've mentioned, adverse effects or steroid phobia. And the strengths of this work are that this is the first meta-analysis in this topic. It only included RCTs, and as I've already emphasized, the clinical implication is also really important. And the limitations are that the heterogeneity is really high and the sample size is small. This is probably the reason for the heterogeneity. So we are really looking forward for the other 4 authors to respond to us, so maybe we can solve or reduce these limitations. And I'd also like to present my second topic, which is investigating the therapeutic effects of platelet-rich plasma in chronic wound management. Chronic wounds are common medical conditions and have a high impact on the aging population. The cost of wound management is estimated to account for 5.5% of all healthcare expenditure, and chronic wounds can also lead to a serious deterioration in the quality of life. The 2 most common types of chronic wounds are diabetic foot ulcers and chronic venous leg ulcers. And here you can see the incidences of these ulcer types and also the annual cost of ulcer management in Europe regarding these ulcer types. So regarding the treatment, standard treatment is smart dressing and compression, where they usually use special bandages, smart bandages, but these smart bandages are not the only thing which are making the ulcer management so expensive, but also the human resources, because the recovery time is really long. So if there's an additional treatment modality which can shorten this recovery time, it's not only good for the patient's quality of life, but also for the healthcare system. So platelet-rich plasma could be this additional treatment modality if proven effective. As I already mentioned, it contains concentrated growth factors and cytokines, which could not only promote hair regrowth, but also tissue repair and regeneration. So our aim is to evaluate the effects of platelet-rich plasma on wound healing in chronic wounds. The clinical question is that does platelet-rich plasma enhances wound healing in chronic wounds compared to conventional ulcer therapy? The population is patients diagnosed with chronic wounds. The intervention is platelet-rich plasma treatment. The comparator is conventional ulcer therapy. And the outcome is wound size. This is our primary outcome. And we could also look at pain and recurrence rates as secondary outcomes. So our hypothesis is that additional treatment with platelet-rich plasma is superior to conventional therapy alone. Platelet-rich plasma could be a new, safe, well-tolerable add-on treatment modality in the treatment of chronic wounds, which could not only be good for the patient's quality of life, but also would be beneficial for the healthcare system. So here you can see the results of the systematic search, which we've conducted in 4 databases, and also the date of the search and the search key which we've used. And here's the flowchart of the selection. Based on the full text selection, 47 articles were eligible. 5 articles were not English, and 15 articles we could not access yet, so we are working on these articles as well. And from the 47 articles, 9 articles included our primary outcome, which is wound size, so we finished the data extraction from these articles, and now we are working on the secondary outcomes from the other full text. So here's an overview of my 2 topics, investigating the therapeutic effects of platelet-rich plasma in the treatment of alopecia areata of the scalp, and also in chronic wound management. I would like to thank you for your attention, and I'm happy to answer your questions if you have any.
Just a very laïc question. How are you applying it to the scalp, the platelet-rich plasma?
It's injected to the scalp. There's more ways, but in this study we are looking at the injected administration.
Have you looked at the confounding factors, or what could be the reason for the heterogeneity in the first topic when you looked at the forest plots?
Yeah, we discussed it with the statisticians, and probably this is the small sample size, but...
Okay, but what I mean, if you go back to your slide, there with the first plot, there are 2 studies that show no significant difference, if I'm correct, and 1 shows significant difference. Is there a difference in the population or in the methodology, or what could be the reason for this?
Probably the population, but the methodology was the same. So.
Okay, I'm just asking because if you're going to publish these data, probably there will be a question from the reviewers as well.
Yes.
So it's important to look into the reports of these studies, what could be the difference and what could be the confounding factors that might cause this difference in their findings.
Yes, thank you for your question and comments.
Thank you. Before the next question, I just would like to add that there are 4 missing studies. And if we will receive these studies, maybe the whole issue will be solved or somehow solved.
Yes, hopefully.
So on this slide, what is the outcome for you did the forest plot for?
The SALT score, the severity of alopecia 2 score, and the mean difference.
Okay, because I can't see it on the slide. And is that something which you can measure objectively? Is that an objective measurement?
Yes.
That outcome?
Yes.
I mean,
yes, it is.
So it's not reported by the patient; it's reported by the.
Yes, by the physician.
By the physician. Okay. Regarding a question to platelet-rich plasma, what is that? How do you do that? How can you get hold of that, and what is the cost of that?
So the autologous platelet-rich plasma, it's a concentrated plasma which contains platelets and cytokines, and the cost of making it is not high. I mean, the machine which you use is can be expensive, but after that there's no high costs, and also it's not painful for the patients. I mean, the drawing blood can be, but that's the only.
So do you need special expertise and special staff to run?
No.
To run it. That's good news. My second group of questions regard your second study, for which you identified 47 studies.
Yes.
So for alopecia, there are only 5 studies you identified, if I remember
7.
well. 7. And for chronic wound healing, there are 47 studies. What is the reason? Have you included other studies than randomized control trials, or are these all randomized control trials?
These are all randomized control trials. I would say that maybe it's the application which is easier, because in the case of chronic wounds we can't only inject it. There are studies where they inject it, so we're planning to make subgroups based on the administration, but they can also use it as a gel, in a gel format, so there's no need to inject it, and maybe that's a more practical way.
And in the 47 studies, there are studies in which they inject it and they use it as a gel.
Yes.
As well.
Yes, okay. So there will be a subgroup analysis.
And so then the question comes, if there are 47 randomized control trials, are there already systematic reviews or meta-analysis in this topic? And what are the results of those, and what is the novelty of your study?
Yes, there is an existing meta-analysis about this topic. They did a subgroup analysis based on the etiologies of the ulcers. And in the case of diabetic foot ulcers, they could prove that platelet-rich plasma is effective, but they couldn't find enough articles about venous ulcers and pressure ulcers. So our hope is that we can find enough articles in regards of these ulcer types as well, and provide further information about these.